welcome. Today we're going to talk about 5G.
In the Netherlands, we have like thousands of companies with technology as their core business, and around 650 to 700 of them have united themselves with the membership of NLdigital.
In November 2006, I launched a service called 3G Doctor. Lets you video call a doctor. The service has now been adopted across things like the NHS, and so you can use pretty much the same service with the NHS, with your own family doctor. It's really important to understand what we've been through because it's going to define how we proceed in this next decade. The mobile healthcare decade transformed the health of society. Now, I was predicting in 2010 that it was all going to be positive, but actually the effects have mostly been psychological and negative.
We for sure can mention the IoT for telemedicine, which is there have been developed a set of medical devices to support the patient and to monitor his vital parameters at home.
Why? Because they allow for more precision than what is possible by hand, for instance. And the challenge that we want is to see whether we can transport this kind of scale really over many miles, and that is what the tactile internet relates to. You could have a sort of exoskeleton, for instance, on a rescue worker, and that the surgeon or a doctor could sort of take over the hands instead of robotic hands, real hands of some person. And then, for instance, in a disaster area, where a victim needs urgent medical attention, a doctor could step in virtually or via the internet and to do some kind of treatment for the patient.
About a quarter of what the 5G investment by 2030 might entail is in healthcare. So a lot of experts see an enormous reach for 5G in healthcare. And one of the most striking examples already mentioned by the previous presenters is the connected ambulance.